9 out of 10 HR professionals I talk to want to talk about burnout because each one of them would tell you right now, as of the recording of this podcast, that burnout is a massive issue. Everyone is talking about it. And this is all sectors. We're talking about tech, talking about finance, we're talking about healthcare, of course, across government, like massive numbers of people right now are reporting that they are having burnout symptoms and even want to leave the workplace. We thought as clinicians, oh, it's going to get better after COVID, things will return to normal. They haven't. And in some instances, they've gotten worse. And so now we're left with this like burnout pandemic. What do we do about this? How do we think about it? And can we provide the tools and supports for people so that they can get back to a work situation that they don't dread, that they don't have that pit in their stomach when they get up in the morning, that they actually enjoy going to work and have fruitful and meaningful jobs. This is what we're talking today with an expert in burnout, Dr. Mary Preisman, who works out of the University of Toronto and at Mount Sinai Hospital. And Dr. Preisman talks about burnout in very practical terms. Why? Because she took it upon herself in her practice during COVID as a psychiatrist to work with healthcare providers who were experiencing extreme amounts of burnout. Now she does talks on the subject, research on the subject, and still works with a lot of patients who are approaching burnout and maybe even have depression or anxiety as a result. I think you'll learn a lot from this podcast, in particular, what we can do to help prevent burnout, what we can do to fix burnout if we're experiencing some of those signs or symptoms. Very useful. Dr. Mary Preisman is the best. She was a mentor and still is a mentor of mine, and I look up to her for everything that she's done for the mental health world. Very honored and happy to have her on the podcast today. Thank you for checking into Beyond the Checkbox. This is Mind Masters. I'm Dr. Ryan Todd, a psychiatrist with over a decade of experience. And in this series with leading experts, we will explore the complexities of mental health, breakthrough therapies, and today's hottest topics. This is Beyond the Checkbox, Mind Masters. Okay. So you've gotten into this like burnout world and interest in like, are you doing research around it? Is it a clinical interest? What's your engagement with the topic?
A little bit. So the backstory is that when COVID started, not that anyone wants to talk about COVID ever again, but when that started, actually Ben Rosen, who you know, and I were trying to figure out how we might be useful beyond just seeing patients and putting on like gowns and masks and things. And we realized that actually what we could do that's most useful is apply our skill set in psychiatry to support healthcare workers, primarily physicians, but also largely nurses and other staff who were like scared and overwhelmed and still tasked to do like all the same work that they were supposed to do before, only with less resources. And it was like expert level, a whole bunch harder than it used to be. So we started doing this project that was called Coaching for Healthcare Workers. And that became like a grant and a paper and some scholarly work that came out of that. But essentially, really, what came out of that is recognizing that people in healthcare are so close or at burnout and that they already were before. Like, there's good data to support that. And that the impact of the pandemic just made that like exponentially worse. So with attention to that, I started seeing more healthcare workers in my practice and made space to work with physicians who were struggling and not necessarily on the back of a psychiatric diagnosis, but just like the overwhelm of trying to do everything all at once.
How do you explain burnout to your patients?
The way that I look at burnout is that when you start edging close to that kind of metaphorical wall, like where the tasks that you have on your plate start to feel like they're going to topple over, there's kind of too much, and you feel a sense of overwhelm about what you have to do, and where you stop feeling a sense of fulfillment, enjoyment, or even kind of tolerability, and you start to dread what you have to do, you start to resent it. You start to have negative feelings about it. Sometimes it's sort of like escape fantasies, not that we don't all wish we could win the lottery, right? But in a kind of more concrete day-to-day way. So not necessarily does it have to be that you're depressed or you have a disorder. It's just that feeling where our to-do list becomes so aversive and so difficult um, that you
Is
can't
it
return to right
and
now.
is it becoming a disorder? Like, do you see that? Like, there's way more conversation about it than there ever has, and probably instigated by COVID and like all the burnout discussion. Do you see it becoming more, getting an official place in the mental health canon?
Yeah, like I think, as you know well, all mental health disorders are kind of the extremes of the human experience. So I think there's probably some overlap between burnout and clinical grade depression. And I think one can sort of lead into the other. I think the reason that burnout is an important category is that that's something that you can pick up before you get to like a full clinical level episode of something. So I think it's a super important thing to recognize. And frankly, like in all of our workplaces, not just for patient care, but in every domain, like we do better work when we're not burnt out. We're better people, we're better parents, we're better partners and friends. So I think it's really important to recognize it, be aware of it, and maybe do preventative things around it.
Something I've always struggled with, and I just wanted to get your opinion on it, is like when you know, and the term burnt out sort of like I think of a matchstick that's been burnt. Like it seems like a binary thing. Like okay, and that's how people use it now too. Oh, I'm burned out. Like I have to stop this thing and take a break, or go on vacation, or stop this job. But I imagine it's not binary. Like you don't get burned out and then it's like you're done. Like you can keep pushing into that space, or you can recede away from that space. Or is it more binary than I'm thinking about it?
Burnout
Because
is a
I've had
spectrum.
experiences.
Burnout is a spectrum. It's not like you're either burnt out or you're not, right? There's no switch that flips. I think it's a sort of like gradual onset, which is why it's tricky, right? It has a bit of an insidious onset where often people don't realize it's happening until they get to that sort of matchstick point. But I do think it's a spectrum, and there are times where you feel it more than others and circumstances that highlight it more than others, but I don't think it's as black and white as burnout or no burnout. I think there's probably a lot of gray area in between.
And people don't know when it's coming on, or they like it happens slowly and then it hits when it's too late. Walk me through that. Like what's been your experience with patient care when folks probably see you when it is like a little bit too late, when they're already feeling that burnt out, I'd imagine. I
Yeah, I
wonder
mean,
why it is that it creeps up on you.
there's two ways in which I try to intervene, right? One is to give sort of talks and presentations to colleagues to try to get them to identify this before the too late point. I think by the time I'm seeing somebody one on one, for sure, they've crossed the threshold where they're at the matchstick level. I think there's sort of like a societal cultural expectation that we work as hard as possible. We have a very achievement based society where your value is assessed by your professional status, your income, your acquisition of goods. So those things tend to be so valued that we work as hard as we can towards that. And sometimes, like with inertia, right? Like an object remains in motion until something interrupts it. So you start a pattern, and maybe it's sustainable when you're 30, but it's not sustainable when you're 52. So you get into a way of doing things that can be hard to change. We don't always reevaluate like how much we're taking on, the impact on our schedule. So many of us do things like work a certain way before we have kids and then try to recreate exactly that after we have them. Only in addition to all the work demands, we also have like this whole other part of our lives. So now we're trying to do everything all at once. And so we don't often stop to reconsider, like, do we need to change something?
Yeah, and that's so hard to do, and you sometimes need like an outside uh, source to tell you. I remember a story of one of our colleagues, Dr. Hunter, John Hunter, who he wanted to when he was young and he just had kids, he wanted to start a new ADHD imaging kind of center. I don't know if you've heard this story from him. And he went to the department head at the time. I don't think it was
It
Mullen
was
Lash.
Mary
I doubt it.
Seaman.
Yes. Okay. And she said, "This is great, but maybe let's do this when your kids are a little older." And I'll never forget that story because that had a deep impact on his life and his durability, and he's still going hard.
Yep.
And I don't think he got burnt out because he kind of paced himself and was able to sustain results and patient care for many, many years.
Yeah, I think you cannot go full force in every area of your life. And for sure, some people can, but most of us, if we are working full time and putting max effort into that, we may not also be doing all of the housework and cooking and exercising and child enrichment and all these other things with the same level of vigor. And if we are, we're probably really tired, right? Like the thing that we end up sacrificing is sleep, or the easiest things to drop are self-care activities. So you're less likely to do a yoga because you need to fit in time for whatever other things that you see as kind of mandatory. And then the things that you see as optional are the things that go by the wayside. And by the way, I hate when we conflate self-care and burnout prevention, that you're supposed to just do yoga and meditate. Like that's such a cliche thing, but it's an example of something that some people do to feel well. I think there's sort of this idea that when things are going poorly in workplaces, that leadership will order pizza and that the employees are expected to do yoga and then everything will be okay again. And it's of course much more complicated than that.
The the thing that I also struggle with is that I think there's pressure from employees who are experiencing burnout, and rightfully so. There's pressure on they put pressure on the organization to say, you can put in all the mental health, wellness supports, EAP, stuff like Headversity, yoga mats. You could put them all over the damn place, but we're still having to do too much with too little. And then there's this push pull because there's only so many resources to go around. Have you seen structural changes in workplaces that have worked? Like, what have you seen, not just from a personal level, like not like upskilling and resilience training and, and taking care of your sleep, like those personal things, but have you seen things at a structural organizational level that have worked? Or is there evidence that stuff is implementable and actually useful in the workplace?
Well, I think I've seen things at the individual level that have worked. So I'm not sure I can comment on institutional level things. I think those are hard because it's trying to make a sort of blanket solution for lots of different people. I do think that things like resilience training and wellness have their place. Absolutely. I think just doing like a 1 hour session on wellness and then telling people that they're well now is not what actual wellness is. So the individual interventions that I've seen, particularly amongst physicians that have been effective, is like reevaluating all of the things that you do and deciding which of them you could pull back from. And what that allows you to do is, first of all, it frees up time, which is the most basic thing, but it also allows you to have more focus on the things that you are doing. So if there's a committee that you've been a member of for years, you may want to reconsider, like, do you need to be on that committee? Is it helping? Is it helping the other people there? Or is it something that you could think about stepping back from? So I gave a talk to the obstetrics residents for their academic half day. And it was around a time where I was going through some personal challenges. There was a lot going on in my life. And I think I was supposed to give a talk about perinatal mental health. And instead, I gave a talk about sort of like well being. and sort of quote wellness. And what I ended up doing was an activity with them where we had 15 minutes to look through all of the commitments that we have and to quit something. And then we were going to discuss it. So it could be anything. It could be a committee like that. It could be a project that you know you don't really want to see through to the end. It could be the gym membership that you pay for that you never go, whatever it was. And so that was the activity that we would all just kind of take the time and come back. And that ended up being a really memorable session, even though I didn't cover any of the clinical content I was supposed to, just because like taking the time to reevaluate what it is that you're doing is like a really powerful anti-burnout tool.
And I love that because there's I think there's a counter narrative to that, and it's not on purpose a counter narrative, but I see a lot of the narrative right now, especially in the workplace, is actually to do more of the things that have meaning for you, and like actually do more, just period. And like what I've found in my personal experience, like with approaching burnout, is that I get a lot of meaning and purpose, and I'm really driven by that. And even if I do those things that are really meaningful and purposeful and I like doing them a lot, even if I still do those things 12 to 14 hours a day, 6 days a week, I will still get burnt out.
Mhm.
So there's this thing about meaning that I think we're missing. Like there's also like uh, just a plain and simple, like if you do something for too long and too much during the week, you can also get burnt out, even if you love doing it.
Yeah, I agree. And I think one of the things that makes us love doing something is being I think one of the issues that comes up with sort of too much of a focus on sort of well-being is that, especially in like training programs, right, where everything is very kind of learner centric, is that we miss the part of wellness where it's helpful to feel comfortable with what you're doing. So having mastery over something makes you like it, right? If you're amazing at playing the piano, you probably enjoy it. If you're tone deaf and you're just doing your best not to make a mistake from memory, you're enjoying it a lot less. So I think like that's one aspect of it. But no matter exactly, you're right. No matter how much you enjoy something, if you spend too much time doing it, it's going to turn into the negative. So you can love to eat, but if you keep eating and keep eating, like eventually it's going to go poorly for you. And that's the case with anything. You can love running, and if you do it too much, you'll get a stress fracture. So there's kind of like a sweet spot of how much you do something, especially at work, especially with things that require a lot of focus, a lot of concentration, or if it's a more physical job, like physical effort and energy. Like there's a point at which it switches from meaningful and fulfilling to just exhausting.
Can you can you talk to me about guilt and even shame and how that fits in? Because I experience a lot of guilt that I can't go as hard as I did when I was like mid 20, like in medical school and residency. Like I'd studied. I'm not the, as you know, I'm not the sharpest tool in the shed. So I had to study a lot, and like, and even to get into medical school, like I would crush like 12-hour study sessions and do that for like days on end to like, pass OChem or whatever the hell. And I don't know, I feel this like guilt or shame that I can't keep that up. I mean, I know I have kids. I know I've been doing it for a while. Is that something that you see commonly, like a shame or a guilt associated with not being able to keep going as hard as we could in the good old days?
100%. So first of all, we're always comparing ourselves to an impossible standard from a time where things were easier. So I just had this conversation with a colleague in the elevator where we were talking about fitness. He was like, "Yeah, I should play basketball again." Like the reason I'm not fit is because I stopped playing basketball. And then we talked about like, well, when's the last time you played? And of course, the answer is like 20 years ago, right? So it's probably not realistic to just start playing basketball again right now. Cause I think when he played basketball, he had um fewer or no kids, like a completely different career, was maybe in residency still. And so we're all trying to look like the way we did in our 20s. We're trying to study as hard as we did. Like I think that phase of life is full of energy for a reason because you are just starting out and you're establishing yourself. You're doing the 12-hour study sessions to get to where you are now. The luxury of where we're at now is that we don't need to study for 12 hours. Like we already learned that. So now we get to do things differently and reevaluate our approach to things. But for sure, there's a sense of comparison to other people, to yourself. And I think all type A people have a sense that they're not doing enough or they should be doing more. We look at, like social media, we look at other people that we see as like ultimate achievers. And there was this phenomenon, right, which I'm sure you experienced too, like you go to work and you think about your kids and then you're with your kids and you think about your work and sort of wherever you're at, you're not quite like doing enough. And so letting go of that a little bit and just like letting yourself be in the place that you're at can be really helpful. But it's super hard. Like 100%. I also think about, when I was in med school and 24 and had the energy to like stay up all night, do all kinds of things, like go to the gym, do whatever, but it's not really realistic to compare yourself to that, and it's really unfair.
The kid thing is interesting, and I want to. What I want to do is tie this into a question of like, is burnout getting more common? And like the reason I want to ask that is because the comparison is so real. Like you're so right in that you're at work, you're thinking about your kids, and like, oh, did like my son, am I a good enough hockey coach? And am I getting him out to practice enough? And like, and then when you're at home, you're like, did I do enough at work? And then you like see like a YouTube short of like the stuff that I get fed is all about entrepreneurs and everyone's rich overnight. Massive businesses never an issue. Like that's just the world we live in. And I can see that contributing to burnout because that upward and sideward comparison is like one of the main things that keeps driving you in a weird way. So are you seeing is burnout more common? Are we just talking about it more? Like
I
did this
think it's
happen in
more
the
common.
70s?
Yeah, so I think it's both. I think we're talking about it more and it's more common, but I think the reason it's more common is that culturally, the expectation now is that we do everything. So, like
Yeah.
rant alert, but 70s, and you were a father of 2 kids, but you were also a physician and business owner. Like, the expectations of your parenting would be like, it's great if you show up sometimes to a hockey game, and that's like what dads do, right? Whereas modern expectations of you is that not only do you work full time as a physician and business owner, but you also are at every practice, you coach the team, you're deeply involved, like you are a hands-on parent who's expected to be there all the time. Now that's not bad, right? Like it's nice to know your kids and it's nice to see them do achievements and you think about them and there were these like tiny little helpless creatures and now they train jujitsu and beat up other kids. Like that's really rewarding. But it also means that that's like a whole other set of expectations. So if you were previously supposed to be like somebody who was out in the workforce, the demands on you at home would be less. So now most people have dual working families where everybody is balancing career and parenting and looking after your pets and managing everything else. So life is a lot more complicated. And in the 70s, people left work and then that's it, right? Like they return the next morning. Now, people can email us, they can call us, we have our phones with us all the time, we get real time updates. So we can't actually just leave at 5 o'clock and then return the next morning at 9. Like there's access to us at all times. So I think like the issue is much more real now. And, like in the 70s, people talked about different stuff and they didn't have like as much dialogue about mental health. Um, Maybe because they were all out at the disco or whatever. But I also think that the things that contribute to burnout are probably a lot more prominent now than they were like a couple of generations ago. In the same way as you could work as like a middle management job, single income family, buy like a large suburban home and a couple of cars, and that was realistic. And there was a time when people vacuumed in pearls and wore suits to the grocery store. So All kinds of things have changed in addition to our workload, the expectations of us, like all of that.
Yeah, wow. There's a lot to dig into there. And I I remember when like COVID hit, right? And we had just started Headversity, and we had always had internal meetings, trying to strategize, think about new ways to approach mental health through technology. And then like COVID hit, and then the next day everyone was on a Zoom meeting. And I remember thinking, this is the most exhausting meeting I've ever attended, like ever. And it was an hour, and like your eyes are straining, and and it was like weird and awkward because no one knew how to do Zoom and Teams and communicate. And I think that's one of the most underappreciated aspects of COVID and burnout is that our world is so digital now, and that digital interface drains our energy quicker than if we're just chatting in person. Like it's changed the way we communicate, and our brains haven't caught up yet. I don't think we talk about that enough.
I agree. I think a few things about that. Like one is that it allowed meetings to bleed into our homes.
Yeah.
So our home was kind of a sanctuary, safe space where you would come in and put on your sweatpants and feel comfortable. And then now you have meetings at home. Zoom is everywhere. Like it's kind of blended workplace and safe place. So I think that's been draining. For sure, staring at screens all day is exhausting. And you just don't get the same kind of socializing, right? Because we all know that pre-meeting and post-meeting are like the meaningful, nice chats where you see somebody and you catch up with them, or you walk back to the parking lot together, or whatever it is. Whereas in a Zoom, it's an amazing platform to help us connect to each other. Like we wouldn't have this meeting if it wasn't for technology because we're not in the same province, but it also means that we don't get to like grab a coffee after and like interface with each other where we see more than just like our head and neck. The other thing that people do on virtual meetings is stare at themselves.
Yeah. I'm big into that.
Time spend a
Yeah.
lot of time evaluating like your flaws, whereas in person you don't do that. So you don't leave a meeting thinking like, the wrinkles around my eyes are much more prominent than they were 5 years ago, right? Like that's not a in-person meeting thing. So we get to criticize ourselves, we get to have awkward social interactions, and we miss those other like really lovely parts of being together. So it's enabling in a way, but it also means that there's just like more for us to do. And now, if you can't come to something, well, you can take the virtual option and still join. So it's harder to get out of things.
Yeah. And there's that social kind of pressure too around it that I think that's changed too. The I don't know, the like socializing post work aspect of life. I think people do work more, and there's been some like pushback on it, like through social media. But I remember seeing a stat early in COVID that we were working about an hour more per day because we were at home, and like, what else are we going to do? I don't know if that still stands, but people, especially in hybrid environments, tend to work a little more, and then they're always on a screen. I just think that's attributing to this burnout phenomenon that we're seeing right now.
I agree completely. I think staring at screens is like not good for our brains. I think it makes us more tired. I think even just like having to look at something like that all day, people have always worked on computers, not always, but in sort of modern technology time, people have worked at computers, but the expectations are different. And I also think that something that I've noticed, I don't know if this is the same for you, is that during the pandemic, obviously social events were canceled and things changed in that way. And it hasn't really come back fully to a socialize after work, like get together. Um, it's just a bit different than that. Like people want to finish work and run home. And that's because they feel guilty that if they don't get there, they're going to miss hockey practice and they're not going to be as hands on. And so there isn't really like maybe there's the desire, but there isn't the capacity to take on more. And so what has to go is the optional things that make us feel good, like going out for drinks with our colleagues after work. Like we couldn't possibly justify that. We've got kids, we have to wake up tomorrow, we have so many other things, like, let's drop that. Or you're chatting with the other parents at hockey and you talk about getting together. Well, you couldn't possibly. You have to do homework, you have to do whatever. And
Yeah.
so you let go of the things that would be fun for you because you have all the things that you must do.
Do you think it's going to get better? Like, what's your prediction on the burnout? Like, are there positive signs? Is there research that can help us? Like, or is it going to get worse? Like, are we going to continue to mount more pressure on ourselves as professionals, parents, people? What's your prediction as to where this goes?
So I think it has to get better because there's got to be a sort of tipping point where people and organizations realize that we're less effective if everybody's burnt out. Like you're getting lower quality work, you're getting more absences, you're having like more challenges associated with these expectations. So the fact that people are more aware and that there's more conversation both in mental health but just in society at large about like boundaries and limit setting, I think that's all going to help. I think there's going to be a sort of swing back towards having a bit of balance, and recognizing that you can't do absolutely everything. So the expectation that we are full achievement all the time, I think we're going to have to let that go. And maybe people will start like going for drinks and apps after work and not feeling so guilty about it. Like maybe that's 10 to 15 years from now, who knows? But, I do
Some
think we get better.
futuristic
Yeah.
utopian world.
In
We'll go
the
for
in the
drinks.
utopian future, we hang out with our friends after work. Uh,
Yeah.
but, like, we also I think we're raising a generation of people, hopefully, that are not just living to work, and living for other people. Like maybe we're raising them to prioritize themselves, not too much to the point that they're selfish, but enough that they can push back against things that are not helpful to them. And so I think we can teach our kids that they can't take on so much. They need to prioritize. So if your kid plays hockey and they're good at it, maybe they don't also need to do every other club and extracurricular activities. So we could teach them that they don't need to be resume building from like age 5. And they could probably just do things that they enjoy. And maybe your kid's like super amazing, but they're probably not going to play in the NHL. So they could look at it from like an enjoyment perspective. And PS, if your kid makes it to the NHL, go see them play.
Yeah, go check out a game. Do you yeah, I'm wondering if like the economy has to play a part in this because like as we speak there's massive layoffs across, well, a little bit in tech but also the government in the US, and I think that's probably going to pile on some of the pressure. So I do wonder if these massive social things increase the risk of burnout and mental health for folks across North America.
One of the things, as you probably know, that contributes to burnout is not feeling safe, for sure, physically, but also psychologically in your workplace. So if you're fearful that you don't know what the expectations are, or you're not sure how you're evaluated, or even more simply, that your job security is at risk, you're much more likely to feel burnt out. So job security is huge. And if people don't have that, then you're kind of walking on eggshells thinking like maybe this is it. So that's a huge factor for sure. There's also like a shift in how long people work at one place, right? Like the comparison to the 70s where you get a job at a high school, you stay there your whole life and you retire from there. Like no one really does that. So some expectation that you're going to shift between multiple workplaces is real. But the idea that you're working somewhere where you never know if your job is secure, like you can't feel comfortable working under those conditions.
I have to ask this as we wrap up because this is something I hear all the time, and there's all these myths about it. Is there a generational difference between resilience and burnout? Like, are millennials, like I'm a millennial, I take flack all the time about being like the least resilient generation. what have you seen? Is there actually generational differences? If we could put people in generations and age groups, if
There's absolutely a generational difference. So first of all, every generation thinks that the generation below them has become weak and can't do anything. And in a way, they're right, and in a way, they're wrong, right? That's just the factor of available technology, the way that people do things. Like every generation has differences. Some of those things make us more resilient, some make us less resilient. So, my grandmother like lived through the Second World War and an immigration and lots of grief and loss of most of her family. And was still like bopping around at her line dancing class and going to travel and whatever. And so she was like a pretty resilient person by necessity. So when I used to call her in med school to say that things were stressful, she used to remind me that when she was in med school in the Soviet Union, they had to hide in a bunker and eat raw potatoes. So I should enjoy my experience. And I was like, oh, okay, thanks. So for sure, that's a generational difference that's real. But it doesn't mean that we want to be living in a time where things are so politically unsafe that we have to be hiding in a bunker eating raw potatoes, right? So generational differences are real. It doesn't necessarily mean, again, that they're bad, but every generation has something about it that makes it unique. And so I think it really depends how you look at it. I think it's funny because like modern kids don't really need to use the telephone, for example. Like that's a sort of lost thing. And I'm sure that a few generations before they would say, like, these kids don't even know how to like insert name of thing that we're supposed to know how to do. So I think important to like maintain a skill set to know how to do some stuff. Um, but I think like resilience is different because you need to be resilient to your current circumstances.
yeah,
Like 100%, I would not survive at my grandmother's medical school, but I'm not sure she would survive at mine, right? Like it's a different environment. She'd have to use like technology and she'd have to do all these other things. So it's not a fair comparison.
it's an awesome, it's an awesome comparison and a great story of resilience. Dr. Mary Preisman, thank you. This is fun, and this is it's good to catch up, and it's good to hear about your experience with working with folks, because I think we hear so much about like research and burnout stuff, and we hear so much about just the like theoretical constructs, but to talk to someone who works with patients all the time and helps them get better, very practical. I think our listeners will really benefit from this. So thanks for joining us on the show today.
I hope so. Well, it's a joy to talk to you always.